this video I'm gonna talking about the electrode gel. It is generally spotting in the exercise therapy exam or the electrotherapy exam. So what is electrode gel? A gel is a solid jelly like material that can have properties ranging from the soft and weak to cold and immobile. Gel is also known as a coupling medium. Air bubbles should not be present in gel because air is reflector for ultrasound and insulator for the current. So you have to check if there is not presence of the bubbles in the gel. The presence of air will stop the transmission of the current in the ultrasound and current between electrode and the body. The gel should be clinically tested not to produce any skin reactions. So you have to check uh, firstly and then apply onto the patient's skin. Ultrasound gel is typically clean and thick but should not excessive sticky. Some patients feel ultrasound gel is very cold, so that might not be tolerating. So for that, some professionals are using the ultrasound gel warmers to reduce the discomfort. Now we're talking about the skin resistance. So our skin is made up of different layers, epidermis and the dermis. So in the diagram, epidermis and the dermis, this is the muscles and the subcutaneous tissue. So these are the layers of the human skin. Now the epidermal layer, that are the stratum cornum, stratum lucidum, stratum granulum, stratum spinosum, and the basement membrane. Okay, so this is the epidermal layers. These skin layers are offering resistance to flow of current from electrode to patient's body. ओके सो સ્કિન લેયર જે છે એ શું કરશે કે રેઝિસ્ટન્સ જે છે કરંટ ફ્લો કરે છે ઓકે ફ્રોમ ધ ઇલેક્ટ્રોડ ટુ ધ પેશન્ટ્સ બોડી તો એ લેયર વાઇઝ કરશે ધ ગેલ્વેનિક સ્કિન રિસ્પોન્સ ઓલ્સો કોલ્ડ એઝ અ સાયકો ગેલ્વેનિક રિફ્લેક્સ ઇઝ ધ મેથડ ટુ મેઝર ધ સ્કિન conductions for electric current. So how to measure the conductions of the electric current into skin? So the method which use, that is galvanic skin response. Then the conduction is inversely proportional to the resistance. If the resistance is more, that means conduction is low, and if the conduction is high, that means resistance is low. So both are the inversely proportional with each other. The factors affecting skin resistance. So cleanliness. First, the resistance of human skin is highly variable depending on several different variables, or whether the skin is clean or dirty. If the skin is dirty, so it affect the current, okay, and it increase the resistance of the skin. Clean skin often has a resistance of about 500 ohms. Dirty skin can have electrical resistance of up to several millions ohms. Okay, so in that type of skin, the resistance is more and conduction is very low if the skin is dirty. So you should take care about the cleanliness. Then wetness of skin. If skin is wet with water or anything, so resistance will be lower. So the conduction is good. Then autonomic nervous system, it varies with the emotion, attention, and the stress. The ANS activity causes a change in the skin's conductivity. Higher arousal will almost instantaneously cause a fall in skin resistance. Okay, that means if patient is in the arousal condition, so the skin resistance is reduced. Under mental stress, sweat glands become more active. Increased sweating will make skin more wet and reduce the skin resistance. So the sweating is helpful. Okay, so if it reduces the skin resistance, and conduction is good in that type of patient. Thank you.